Welcome to Reviews and Revisits. This is Lion Runner here. Let's review coronavirus. It's our big nemesis in society right now, the world over. The World Health Organization has declared it a pandemic, not yet an epidemic, but a pandemic. And all of our sports teams across the U.S. are canceling seasons. Trump is banning Europeans from traveling to the United States, and a lot of us are being sent home to work from home if we can work remotely, even though my company only did it for one day. So anyway, we'll see about that. But what is coronavirus? What is the history of it, and where does it come from? Let's start with that. So corona means crown, and so coronavirus references this this endpoints on the coronavirus that stick out from the virus when you look at it, that looks like a crown. And it attaches to other crowns on different types of biological material, on cells inside of an animal's or human's body, or a plant body in the case of a plant virus. And so coronavirus, this coronavirus that we're dealing with right now, the Wuhan virus, or as it's being called also, the official name, let me look at that so that I get it correct, is the novel coronavirus COVID-19, novel or new coronavirus. So it's the new coronavirus because it's just the latest in a stream or in a family of coronaviruses. This is the only one, right? We've dealt with other coronaviruses in the past. So coronaviruses, all that I know of, emerge from animals, and they all have those crowns, appendages on the end of them. A virus is a very tiny item, a very tiny uh, uh, metabolic mechanism that is many times smaller than a human cell. And when they look at it under the microscope, they're always like wrapped in a protein, and sometimes also a lipid covering. And that's how they fool the body to be able to move through the body, because the body typically sees it as a protein. That's how HIV became so virulent. It would move around in your body as a protein covered mass. Then it would get in your cells. It would get replicated in your cells as a protein, because your cell just saw it as a protein, which is good for it. It'll replicate the virus, and then the virus will activate, and it'll explode the cell and destroy your immune system, destroy your T cells in the case of HIV, and destroy your immune system, and then just attack your body with opportunistic infectious diseases. So, previous coronaviruses that we've dealt with, I'm sure you all remember the outbreak of SARS. You remember MERS. Those are both coronaviruses as well. MERS, I know, came from camels in somewhere like Yemen or somewhere on the Arabian Peninsula. I try to recall SARS, if it started with bats. It was a virus that started in bats and transferred through another animal, and kept mutating until it could jump species. And that's what happens. These viruses mutate till they can jump species and connect with the human body. So that's how we get these animal viruses that end up in the human body. And while they previously might have been fine in an animal, right, the animal's body was adapted to it. In the human body, it becomes a toxic detriment that starts to make people sick. So it spread as a I guess a contagious disease, really, um, and and it has various. So the method that the way that it spreads is through the air, right? It spreads through droplets in the air, so your snot droplets, or from those same types of nostril droplets and whatnot being on a surface, as someone touching the surface. So you wipe your nose, you grab a handle of a door, somebody else grabs the handle of the door behind you, and they get that virus on them. I guess once they touch their face or their mouth, or put their hand on their food and it goes in their mouth, the virus has entered that person. So it's communicated through uh, kind of interpersonal contact with other people. And so that's why they are trying this distancing tactic, which is what you can kind of call um, this tactic to try to keep people from uh, being in the same environment with one another, getting people from being in large groups, or just to keep people away from each other as much as possible, so that the virus doesn't spread from one person to another. Uh, there's a circumstance called community spread, where you're seeing spreading happen within a community. And in some places, I think, like where I live here in Nashville, from what I could tell, the two cases that we initially had were both from out of town, and they were both people who traveled out of town. Apparently, got contracted the infection while out of town, or contracted the contagion while out of town, and then came back with it and were pretty early on quarantined and didn't pass it to anyone else. So we're not really having community spread. So based on Dr. Fauci, I believe he's with the CDC, or he's with one of the agencies of the Department of Health and Human Services. He was with the CDC at one point in his career, and he was talking yesterday in the national press conference about you could still have, uh, for instance, political rallies, probably and he said he would leave it to the city, the particular individual city, to determine it based on whether or not they're having community spread. Then by last night, everybody was canceling everything once Rudy Gobert got contracted the disease uh, in the NBA, and they canceled. The rest of the leagues canceled. What I worry about, though, however, uh, if we're not a little bit premature with that, certain cities and states, particularly in Washington, in California, in New York, where there was community spread seen, I definitely think that you wanted to limit crowds and start canceling any large crowd events because there was evidence of community spread. Um, and that made a lot of sense in those cases. But to start basically quarantining the entire society, shutting down the economy in places where that's not happening, and doing it so early on in the cycle, the inevitability is that what you're going to find is that you're going to have cabin fever and fatigue with all of this basically mass quarantine or this mass distancing, and people are going to get very tired of being locked up. People are going to be under economic stress or distress from people on the lower end of the wage scale who have jobs that cannot be done remotely, who have hourly paid jobs where they're not paid a salary, or not paid as exempt. And they only get paid when they work, and so they can't get paid unless they physically go into somewhere. If their job gets suspended, or if their industry is reliant on things such as um, sporting events to happen, they work in food service at sporting arenas, their jobs basically go away. And you can see what's happening with the stock market, and there's going to be a lot of fatigue and economic panic around the economy's greatly slowing down. People are going to get tired of staying home and being locked up, and then everybody's going to rush back out. I think at a point in time when the opportunity for the virus to spread more virulently will be stronger, because I think we maybe might have been a little bit premature on rushing to just quarantine everybody everywhere, and to have this distancing everywhere where there's no community spread. Where one of the foremost disease experts in the world, Dr. Fauci, was saying just yesterday morning that it wasn't necessary in communities where there was no community spread. But overall, this is definitely a serious thing. Um, and another thing is we're not sure about the incubation period. I've heard 2 to 14 days, but the health authorities are not clear on whether or not you can spread corona during the incubation period. Evidence that has been kind of discovered, or not discovered, but um, going from research that has been done so far, the preliminary evidence would suggest yes, there is at least some level of being able to pass while you're in the incubation period. You're asymptomatic, you're not showing any symptoms, and you could still be spreading. Though I believe we're going to find that the likelihood of spread in that condition is weak versus when you're symptomatic. And also, what has been found. The Surgeon General said this in the same press conference with Fauci. I forget the Surgeon General's name, but that there's a correlation of protectiveness amongst young people. There seems to be some protectiveness in being young. So children uh, are basically seem to be largely protected against this virus, and most healthy people who don't have either uh, uh, most people who don't have a underlying illness already, who don't have a compromised immune system, and who aren't elderly, basically at best are going to receive mild cold symptoms and be fine. Some people will receive more severe cold symptoms, but will still survive and be well in not too long of an order. About 80% of people with very little treatment spontaneously recover. The people who are at most risk are people um, late in age or who have a compromised immune system or already have an underlying illness that's weakening their immune system's ability to fight off the results of coronavirus. Uh, the Surgeon General said the average age of death in the U.S. from coronavirus is 80 years old. Again, to my point, why I think the distancing and the quarantining is a little premature, uh, because it seems that the response is hackneyed. It's not planned to me, and it's tactical rather than strategic. Rather planning the overall long-term response. What are we going to do about people who are on the low end of the wage scales? How do we secure them economically so that the ones who are sick will be willing to stay home? Some people can't just decide to stay home. Like they don't work. They literally don't eat. And so we didn't. None of this was planned. Um, they shut down schools like Harvard just shut down and said people have to leave in 5 days, but some people can't go home because they don't have a home. Their dorm room is their home. They don't have parents to go back to. Everybody there is not wealthy. Some people are probably living in their car, doing if the school wasn't open, they'd be sleeping in their car. And the only reason why they have an indoors to go to is because they have a scholarship that pays for a dorm room. And so a lot of these decisions were made without taking all these things into consideration. It's also been noted by experts, including Jay Carney, who was the former head of Health and Human Services, has said that it's past the point of trying to quarantine people coming from other countries. Coronavirus is already well established within the U.S. You have very little value in doing that versus having that same energy, effort, and expense go towards getting testing kits developed and out to the public. But yet, still, after the fact, after it's already too late, we're coming down with pronouncements to quarantine people, and it's already too late for that to be very effective, where there's way more efficacy in getting tested done. Again, I don't see a strategic plan here. I see tactical, reactionary, hackney, ad hoc uh, items being done, things being done, just off kind of the shooting from the hip. But anyway, that's a basic review of coronavirus. Uh, take your precautions. Go to the CDC's website about coronavirus and find out more about it, right? How you can prevent and protect yourself. If you have the opportunity to get a mask, you could use that. You definitely want to wash your hands and use your Purell. You want to not grab doorknobs if you can help it. Carry a rag around in your pocket and use that to open doors and things of that nature. And stay away from people if they're coughing or sneezing. Don't shake hands. Do the elbow bump thing. And let's all try to stay safe and stay healthy. That's it for me, Lion Runner, and I'll be back with you for another video as soon as we have the next item to review or visit.